Hello everyone, I'm Gurleen Kaur, counseling psychologist at Talk to Angel. Welcome to our channel series Clinical Disorder, episode 12 Social Anxiety. So we have Dr. R.K. Suri, clinical psychologist with us. I have some questions related to social anxiety to ask you today. So my first question to you is what are the signs and symptoms of social anxiety and how can I manage it in daily life?
See, as far as social anxiety is concerned, Gulin, first and foremost thing we must understand that it is with reference to the person has a context that he or she feels difficulty and feel fear of being judged or fear of that something is going to be awful to him or her in terms of being valued negatively. That's why he or she tries to make avoidance in the social context. And that kind of a fear or anxiety makes the person anxious and he avoids the social interactions.
So that was very informative. My next question to you is what are the causes of social anxiety?
So as far as the causes of social anxiety is concerned, one of the cause is genetics. The other cause could be that there are chemical imbalances in the brain. The third could be a learning, a fear which is coming in the mind of having a social interaction where one has been made laughing stock or one feels that he or she is being judged and valued in a more negative manner. So as a result, he gets certain triggers. So those triggers becomes an important aspect of his or her evaluating himself or herself, and that causes a further anxiety to him, and accordingly he or she avoids the situations or events.
My next question to you is how does social anxiety impact relationships and social bonds?
As I mentioned, that person becomes too judgmental or fearful of being evaluated by others. As a result, he or she tries to make critical judgments and try to avoid. On account of the same, the social transaction and social relationship between a romantic partner or with colleagues or with others becomes a difficult thing. As a result, the bonding becomes difficult, and at times the person is not able to reach, and he or she is being considered as egoistic or whimsical, not able to relate to their social encounters and transactions. As a result, the relationship becomes difficult to manage.
So, my next question is what are the underlying cognitive distortions that contribute to social anxiety?
See, as far as the cognitive distortions are concerned, the first and foremost cognitive distortion is the denial and avoidance, and then jumping to conclusion that somebody is going to be making a judgment on me, and that causes a lot of concern to him or her. Now, there are lot many cognitive distortions which comes to the individual's mind, unknown thinking or mind reading, etc.
Other question is what are the most effective treatments for social anxiety and how can I support a friend or loved one with social anxiety?
A very pertinent question, Gurleen. We all faces some kind of discomfort in the first to second interaction with the people, but as we move on, as we build up a relationship and bond, this anxiety needs to be treated and managed. The best technique which has been used widely is cognitive behavior therapy and exposure therapy, that more and more practice is being done to overcome it and at times the EMDR, the any childhood traumas are there, so the EMDR also helps in terms of overcoming those childhood traumas or the PTSD issues which has been associated and with the social avoidance and social interaction judgmental process. So EMDR, mindful relaxation, mindfulness, cognitive behavior therapy and the psychotherapy At times, the dialectic behavior therapy is very useful. So, the clinical psychologists trained at Psycho Wellness Center and at Talk to Angel are duly competent to handle such cases. I would refer that anybody who is having a concern on social anxiety must get evaluated with our clinical psychologist at Talk to Angel, and also take regular sessions with psychologists and therapists and Talk to Angel.
Thank you so much, sir, for such an informative session. See you in the next time.